Okay, welcome back. Now we learn about primary amenorrheas and secondary amenorrheas. Okay, if a lady came with amenorrhea, what to do? Okay, if a girl came with amenorrhea, okay, this is the she didn't even see once. Also, she didn't even see the menses in her life. Okay, at that time, at that time, first thing you will see the secondary sexual characters. What are secondary sexual characters? You know, pubic hair, axillary hair, breast development. These are all okay. If secondary sexual characters are present, absent. Okay, if secondary sexual characters are present, and then you will see the age. Okay, if age is 16 years, age is 16 years, secondary sexual characters are present but no menses, but she has no, there is no menses. Okay, no menses. Then what to do? Okay, then first thing is what happened, as there are secondary sexual characters and there is no menses, then you will see ultrasound. You will see ultrasound. This is easily available, na? So ultrasound, in ultrasound, if uterus is present, okay, uterus is present, okay, uterus is present, okay, and in ultrasound uterus is absent, okay, uterus is absent, okay, uterus is present, uterus is absent, then you go for karyotyping. Karyotype, if it is 46XX and uterus is present, that means it can be, that means it can be endocrine or anatomical. Okay, most common is anatomical, right? Anatomically, there is something obstruction. That means uterus is present, but the blood is not coming out. So it can be because of imperforate hymen. It can be because of imperforate hymen. It can be because of transverse vaginal septum. Okay, transverse vaginal septum, or else the vagina is only absent. Okay, it can be because of absent vagina. Okay. Next is these are all anatomical causes. Okay. Endocrine cause. Endocrine cause. It can be because of hypothyroidism. It can be because of hyperthyroidism. It can be because of hyperprolactinemia. Okay, prolactinemia. It can be because of Cushing's. It can be because of PCOS. Okay, these are different conditions where you can see primary amenorrhea. Even in PCOS, you can see primary amenorrhea. Remember that. Okay, PCOS also you can see primary amenorrhea. Next, if uterus is absent, then also you'll do karyotyping. Then also you'll do karyotyping. If it is 46XX and there is no uterus, then it is MR, KH syndrome. If it is 46XY and there is no uterus, then it is androgen insensitivity syndrome. Okay, remember. And I remembered like absent, androgen insensitivity is absent. Okay, in that. That's about age if she is 16. If secondary sexual characters are absent, okay, and you see the age, okay, age is in, you start this investigation, the whole this scenario, you start when there is 14 years old itself, okay. Okay, if second there is no breast development, there is no pubic hair and all, then you don't wait till 16 years. You will start the investigation by 14 years. So investigate by 14 years. That is the question. Okay, that's it. Okay, now we'll see what will happen in case of 14 years lady. 14 years girl. Okay, we'll see here. So secondary sexual characters are absent, and the age of that lady, that girl is 14 years. What to do? First thing, what we did in 16 years? Ultrasound. Okay, so in ultrasound and karyotyping, these two things we do, right? Ultrasound and karyotyping. So in ultrasound, uh, and everything is normal and there is no normal karyotype. What is normal karyotype of girls? 46 XX. If it is like this, if it is everything is normal, then you will see hormones. What hormones? FSH, LH, and height. Okay, FSH, LH, and height of that girl. If everything is normal, then it is normal. If FSH is low, LH is low, that means the main big boss is gone. What is the main big boss in HPO axis? What is the main big boss in HPO axis? HPO axis, HP, right? So, so there is problem in hypothalamus. There is problem in pituitary gland. Okay, that can be the thing. So at this point, you'll get the height. Then you will see the height. Okay, if height, in case of height, if she is short stature, if she her height is small, short stature girl, then it can be Kallmann syndrome. It can be Kallmann syndrome. If it is normal height, then it can be because of constitutional delay. It can be because of constitutional delay. It can be because of anorexia, it can be because of weight loss, it can be because of stress. Okay, all the young adults and girls think of losing weight and all. Though these 14-year girl also thinking like that at that time also, there can be primary amenorrhea. Okay, in case of FSH LH, if there is FSH high, LH high, that means it is like menopause symptoms, looking like menopause symptoms in a 14 years girl, then it can be premature ovarian insufficiency. Okay, premature ovarian insufficiency. Then that 14 years girl parents will say, "Ma, she's only 14 years and you're saying that she's entering into premature ovarian insufficiency. Why?" Then you'll ask the history. Okay, history there particularly in particularly they'll say there is some history of chemo radiation, there is some history of pelvic radiation. Okay, there is some history of genetic things. Okay, in this way, these histories can be seen in case of POI. Okay, then that's about normal carotid, and ultrasound is also normal. Normal ultrasound, normal carotid. Okay, if in ultrasound, so it is a streak. If in ultrasound, there are streak gonads, and you did karyotyping, which shows 45XO, then it is, you know, all know, that is Turner's syndrome. Turner's syndrome. Okay, if in ultrasound, there is streak gonads. See, always remember streak gonads means not only Turner's. Okay, then you should see the karyotype. If it is 46XX, 46XY, then and you see the ultrasound, then it is Swayers. Understood? Understood? So this is about secondary sexual characters absent in a 14 years girl. Now once again I'll repeat the primary amenorrhea thing. Okay. Hmm. So first thing, if a girl came with primary amenorrhea, if a girl came with primary amenorrhea, then you will see the secondary sexual characters, that is pubic hair, axillary hair, and breast. If secondary sexual characters are present, then she is 16 years old. By this time, she's 10th standard. She need to get the periods, but she's not getting menses. 10th is also considered she's coming into +1. No menses. Then you'll go for ultrasound. In ultrasound, if uterus is present, then you'll go for karyotyping. If in ultrasound, if it is uterus is absent, then also you'll go for karyotyping. In case of uterus absent and 46XX, it is a markage. In uterus absent, in karyotyping is 46XY, then it is absent na A. So, androgen insensitivity syndrome. Understood? And if the karyotyping where uterus is present, karyotyping showing 46XX, understood? She is normal here, she is normal here. Then you can be anatomical, it can be endocrine. Anatomical is imperfect hymen, transvaginal septum, absent vagina. Endocrine hypothyroidism, hyperthyroidism, hyperprolactinemia, Cushing syndrome, PCOS. Okay, that's about 16 years with secondary sexual characters, 10th, 11th standard girl with no menses with secondary sexual characters. Okay, now a 14 years girl, she's the ninth standard, and she came that the mother brought her, and she's saying that there is no menses till now. She's ninth. All the peer students got in seventh only. She's not getting menses. Why? Then at the time you go for ultrasound, and you first examine the secondary sexual characters. If secondary sexual characters are present, for example, in this same scenario, if secondary sexual characters are present, what you'll do? Wait. Understood? You'll wait. Why? Because secondary sexual characters are present. So even though if she is present and she's 14 years, then you'll wait. If this lady, this girl becomes 16 years, then also there is no menses, then investigate. You understood the scenario? So, if a 14 years girl came, if a 9th standard girl came and her mother is saying she had no menses, first examine her. If there is no secondary sexual character, then you'll go for ultrasound and karyotype. In ultrasound, if everything is normal, ultrasound normal, karyotype is normal, then normal. And everything is normal, ultrasound normal, karyotyping is normal, then you'll go for FSH, LH, and height. If FSH is low, LH is low, means big boss's problem, that is hypothalamus and pituitary problem, then you'll see the height. In case of height, if she's short stature, then Kallmann syndrome. So very important question is, you don't remember this flow chart in exam. Okay, you should remember Kallmann syndrome, the FSH and LH is low. So in question they'll give a scenario of low FSH and LH, short height, So obviously you'll think, are primary amenorrhea, short height, she's saying, is it Turner's? You think that, but they get 46XX. It is not Turner's. Short height, primary amenorrhea, 46XX. What can it be? How is the ultrasound? Normal. 46XX isn't MRKH. Okay, no, because ultrasound is normal. And they're saying FSHLH is low. So it can be Kalman syndrome. Then you'll see, rule out this is Kalman syndrome. Okay, understood? So Kalman syndrome. Okay, Kalman syndrome where the brain is getting, big boss is getting affected. Man, big boss is getting affected. What is big boss? Big boss is FSHLH, right? Hypothalamus pituitary. These are getting affected. So there is low FSH, low LH, and short of height. Okay, if height is normal. See, if short height, then only this one. If everything is the same scenario, but there is normal height, same scenario. Like a big boss is affecting, LH is low, 46XX, but height is normal. Then you'll see it's constitutional delay. That is anorexia, weight loss, stress. Okay. If big boss is more, like FSH is high, FSH is high, very important. It is like menopause. So it is like premature ovarian insufficiency. It can be because of chemoradiation, pelvic radiation, genetic conditions. Okay. That's about ultrasound if it is normal. If ultrasound showing streak gonads with 46XO, that is Turner syndrome. Ultrasound with streak gonads with 46XY, that is Weyer syndrome. Okay. This is about primary amenorrhea. In next class, I'll tell about secondary amenorrhea. Thank you.